So it's post-surgery day 2. I'm counting yesterday as day 1 because I had surgery early in the morning. Um, I didn't sleep great because I found that it was really quite painful to lie down flat. So I was propped up with some pillows and I had the bed sort of like this. And then eventually I got some sleep. Um, Today's been good. It's 12 o'clock. I've been up since about 6. I have noticed an increase in pain today, so I'm walking a lot more slowly. Um, the wound site feels very, very tight. All of the ribs that were sutured feel very, very tight, and also I'm getting quite a lot of pain in my back. Um, but it's very different to the pre-surgery pain. It definitely feels like surgical pain. Um, I'm on quite a few painkillers, and they are working. I mean, it's the pain is like maybe a 3, so it's there, and it's quite sort of it's more annoying than painful. Whereas my pain before surgery was horrific. Um, when I walked to the toilet, it took me. It's not far at all, but I had to take little shuffle steps. Probably took me about oof, 7 minutes. If I stood up before surgery for 7 minutes, I would have had I would have had to have lay down straight after. I would have had that awful shoulder blade and spine pain, and I can't feel that, so I'm really hopeful. Um, I think I sound a bit down today. I'm not down at all. I'm really positive. It's just the meds that I'm on are really chilling me out. So I definitely do feel good. Um, I didn't feel like I could get a shower today. Um, I'm hoping that I'll be able to do that at home. I can go to the toilet on my own. Um, Getting dressed, it's going to be difficult to do the lower half because I can't bend. But the upper half I'm fine with. I did some stairs. My mouth's really dry. I did some stairs with the physiotherapists and with the stick, and that was okay. I'm quite cold and quite shivery, so that's why you might be able to see that. I had some acupuncture as well with Robin at just around the surgery site and in the back as well, and that helps to relax things. And I've also got a lidocaine patch on the back as well. It is uncomfortable and it's very tight, but like I said, it's much easier than the pre-surgical pain. I do expect that it'll probably get worse as the anaesthetic wears off more. Maybe day 3 or day 4. But I'm actually going home today. I will need help getting in, and that was the last thing. Yeah, getting in and out of bed. That's the most difficult thing, because even if I want to use the oblique muscles on the right side because they've been cut through, they just like won't work. But that's normal. I remember that with the last surgery I had on my abdomen. So I think maybe in a week or so, once that's healed, things will be a little bit easier. I think that's it really. Yes, I'm going home today. One of the nurses is going to help me to get into Dad's car. The journey's probably going to be quite nasty, but I think that's going to be the worst part for me. And once I'm at home, it's just a case of managing each day and taking things as they come. really. Um, Again, I don't know how often I'm going to be doing the bloggy stuff, but I want to sort of have a true account of what's going on, so that other people might have some idea of what to expect. Um, but honestly, so far, I can say it's been much easier than I thought it would be, um, and the pain has been easy to manage, which is really good. And the meds are great. I feel really chilled, um, and really positive. So it's all really good. So I'm home. It's day 3. I came home yesterday. Um, I'm really glad that I did, because about an hour after I got home, the anaesthetic, local anaesthetic, wore off. And I think if I'd come home today, it would have been much harder. The journey was difficult. There were a few speed bumps and turns. I had a lot of pain in my back, um, around the rib heads. Getting out of the car was interesting because I can't use my oblique muscles, because they were cut through on the right side. So um, I had to sort of, because my dad's car's really low, I had to sort of turn out onto my knees, drop to the floor, and then I could use my legs to get up. And although it looked ridiculous, it worked really well. Um, the noise you can hear in the background is just the cat. Yesterday, I managed to get into bed with a lot of difficulty. I can't lie flat yet, so I was propped up with lots of pillows. I got a V pillow, which I'll probably show you later. Sitting down is very uncomfortable, but I'm on a recliner at the moment, so I'm not too uncomfortable. What I have noticed is when I cough, that is, if you're having this done, please make sure you have a pillow to brace with and hug if you cough, because it's very painful. None of the pain that I've had since surgery has been as bad as the pre-surgery pain. I'm on day 3 now, and people in the groups have said that days 3 and 4 are the worst. I don't want to get too, comfortable. I don't want to think that this is it, because, it's based on what other people have said. It is a hard recovery, and it is going to get harder than this. But at the moment, the pain is manageable. I suppose it's important to mention that in the UK we get quite a lot of pain medication. I have propranolol, which is for migraines. That's unrelated, and I have the amitriptyline, which I was taking since November, for nerve pain. I've got to inject myself once a day, with some stuff that I think it just stops blood clots. And we have to wear these socks, the white ones. They're really tight, and they just help to stop clots and things. So yeah, I've got to wear those for 6 weeks. I got out of bed this morning myself. I slept well. I slept right through, which surprised me, because normally, I'm not very comfortable sleeping on my back. But I was very tired. I slept right through. I woke up from my meds at 8 o'clock. I had those next to the bed. And then I got up at 12. It took me about 15 minutes to get out of bed. It's really strange, because normally we use the oblique muscles to get out of bed, and I can't use those on one side. So it was difficult and painful, but I did it. Going to the toilet is strange. It takes quite a while for me to be able to get things moving. If I go for a wee, I still haven't been to the toilet the other way. I'm getting quite a bit of gas and discomfort, but the codeine that I'm on, and the morphine, they're opioids, so they sort of bung you up. I do feel a little bit away with the fairies. That's a British phrase for sort of a little bit loopy, because the meds are very strong. But apart from when I cough, they are keeping things at bay. Walking is painful, but not in the same way as before surgery. I can't feel my 11th rib jiggling around inside me at all. And in the car journey yesterday, normally if I'm in a car, I could feel my 11th rib literally moving this much inside me and hitting things. And I couldn't feel that. So I think that it is secure. I do have a lot of pain in my back, but I think that that's just because, the ribs have been moved. It feels more like muscular pain than nerve pain. But until I come off the opioids in a few weeks, it's hard to tell really. I think that the pain will probably get possibly a bit harder once I've come off the really strong meds. But I'm just going to take it day by day and week by week. I keep saying it, but so far for me, the post-surgical pain has been nowhere near as bad as the pain that I had pre-surgery. I do need a lot of help. I've got this grabber because I can't stretch or bend or anything. I haven't managed to have a shower yet. I don't mind telling you, we're all adults. When I went to the toilet yesterday, tried to go to the toilet yesterday, I had to have help to pull my pants up because I couldn't do it. I couldn't bend. So that's something to bear in mind. I can't remember what else there is. These meds are really strong. I've got sent an email from my surgeon last night. I'm going to have like a rehab program to follow and some questionnaires to fill in at different points in recovery. And then I'll see him again in 4 weeks for a review. But yeah, I feel good. I don't really feel like I can do the normal things that I would do. I don't even feel like watching anything but the television. Television's here, and normally I used to sit over there. So yeah, I'm just talking rubbish now, but it's the meds. They're very, very strong, so I'm going to stop. But yeah, it's day 3 and I'm doing well.